Stroke paralysis treatment can take a variety of forms. What works for one person might not work for another. Therefore, it's important to experiment with different recovery treatments for post-stroke paralysis to find the one that meets your unique needs. These treatments are not guaranteed to cure paralysis, but they can help increase your chances of recovery. With that, here are the best stroke paralysis treatments available. 1. Passive exercises. Perhaps the most scientifically verified way to regain mobility after stroke paralysis is to practice passive exercises. With passive exercises, you do not move your muscles on your own. Rather, your affected side is moved on your behalf, either with the help of a therapist or caregiver or by using your non-affected side. Even though you are not making the movements yourself, it helps stimulate the brain and activate neuroplasticity. These exercises may also help minimize spasticity and reduce the chance of getting contractures. As you move through passive exercises, focus intently on the movement, watch the movement with your eyes and think about the movement in your mind. Eventually, the connection between your brain and muscles will improve, and you might regain a small amount of your movement. To help you achieve this goal, you can use interactive home therapy devices like FitMe. The FitMe motivates users to accomplish hundreds of repetitions during each exercise session. These exercises can be done passively, too, which has helped many survivors like Ron's success story regain movement after post-stroke paralysis. 2. Mental practice. The advantage of mental practice is that it's accessible for paralyzed individuals. Mental practice involves visualizing yourself performing a movement that you want to perform. The practice is all in your head and requires no actual movement. Although you aren't doing the movements in reality, the mental practice still helps activate neuroplasticity and rewire the brain. Then, when you couple mental practice with physical therapy, you can see incredible benefits. In fact, studies show that combining mental practice with physical practice helps improve mobility in stroke patients. 3. Electrical stimulation. Another stroke paralysis treatment with plenty of research behind it is electrical stimulation. When gentle electric currents are applied to the affected muscles, it helps the muscles contract and initiates movement. Once again, although you aren't doing it yourself, it still helps stimulate the brain and activate neuroplasticity. And when you combine electrical stimulation with stroke exercises, it's even more effective. As you can see, many of these treatments should be combined for the best results. Ask your therapists if electrical stimulation would benefit you, and be sure to have them guide you before trying this on your own at home. 4. Electro Acupuncture. Acupuncture gets mixed results, but it's definitely an option to consider. This treatment involves the insertion of thin needles into specific points and meridians on the body. When electrical stimulation is applied to the needles, it provides a host of stimulation for your brain and body to process. As you can imagine, combining electroacupuncture with physiotherapy or an effective home exercise program can seriously pack a punch. It's all about waking your brain up with stimulation, which lets it know that your body is there and ready to get moving. 5. Mirror therapy. Finally, tabletop mirror therapy is a great way to recover from hand paralysis after stroke. It involves placing a mirror over your affected hand and doing hand therapy exercises with your non-affected hand. This tricks your brain into thinking that you're moving your affected hand and helps rewire the brain. We have also heard a unique hand paralysis story where a woman combined mirror therapy with passive exercise to help her husband regain movement in his paralyzed hand after stroke. It just goes to show that there's hope when you get creative and try different approaches. Thanks for watching. Don't forget to subscribe.